Hey, this is Dr. Tasha Rogers, and I am back. If you are new to my channel, welcome. Do not forget to subscribe because I drop fire videos like this all the time. Turn on your notifications. Make sure you like the video. You can like it before you even watch it, girl. Like the video and then share it with whoever needs it. Sometimes this, especially today's video, this might be a way of you being able to express, I guess, some stuff without expressing some stuff. So, anyways, today we're going to talk about what males or what you should be expecting from your partner's visit with his doctor. Like we always talk about our visits and what we're supposed to be getting, what we're supposed to be getting. A lot of times these dudes do not go to the doctor because they're scared. And they're scared because they don't know what to expect or they don't know what they should be expecting, meaning what's normal and what's not. Because I'm going to flip a couple of y'all wigs back with some of the stuff that I'm going to tell you, because I actually learned it from a male physician, because I don't do males, I do females. So I learned this from a male physician. I was like, wait, what? So we're going to have a conversation. One of the biggest things that you will always hear me say is his health is your health. Meaning you can't have a healthy vagina, a healthy sex life, a healthy this, a healthy that, if this dude is not healthy as well. And you can't make another adult individual do anything, but we can encourage, we can discuss, and we can help them understand. And sometimes I think that the more we understand and we can break it down to them in a comfortable way, either one, you should be going to the doctor with them, because why not? That is the person you care about, right? Or two, at least you can give them the information and the confidence, which will empower them when they go to the doctor to either ask certain things or be like, and I think it's very, very important so that they can get the best out of their exam, because they want to get out of there. They don't want no pain. They don't want nothing exposed. They don't want to know about. If it ain't killing me, I don't want to know about it, and I'm out of here. And that's not what we're going to do as grown individuals, okay? We're going to get the most out of these visits. It's hard enough to, to have healthcare providers in this day and age do what they're supposed to do. And then you want to get out of there without them even doing that? No, we're not doing that. We're going to teach them, and I want you guys to have a pen and paper, forward this to the dudes, and I'm just going to kind of run you through what a male exam should be. And, obviously, once we stop going to a pediatrician at the age of 18, we should take up with a primary care provider. And in my personal opinion, once a male hits between 35 and 40 years old, he should have a urologist, because why not? Like, you have a whole appendage hanging from your body. Like, why are we not seeing a specialist for this? Well, my primary care can do it, right? But, at the end of the day, it's just one of those things. Primary cares are great at everything, but don't really hone in on anything. And I feel like, yeah, your primary care could do your pap smear as well. But when they do your pap smear and then it comes back abnormal, they can't do anything else. They got to send you to me, which is then rather awkward, because I don't know you, you don't know me, you're coming in with the problem, and I'm like, okay, what is happening here? And you're looking at me like I don't know you anyway, and I don't really want you doing AB. It's just awkward. So not to say that your primary care can't do your pap, but it's just not the best way to deal with things, right? And so the same way, not to say that their primary care can't do their examination and their assessment for their whole ding-a-ling-a-linga situation, but I just don't think it's the best way to deal with it. But anyway, let's get into this. You guys are free to agree or disagree. It's okay with me. I'm just giving you the information. Now, when they go into the doctor's office, obviously, it's going to be a scheduled examination. Again, if it's your partner, I think a lot of women look at it as distrust to go with them, but this is not about trust. It's about well-being. And don't get caught up into thinking that test results and them going to be tested is about trust. It ain't about trust. It's about their well-being and your well-being, because you're with them. Make sense? Okay, so whoever goes to the doctor, either them by themselves or you with them. Obviously, vital signs. Vital signs are just that. People just take it like, oh, what's this and what's okay. Vital signs are just that. They're vital. That's why they call them vital signs. They're very important, and it tells you a lot about your health. Obviously, it's going to give you blood pressure. It's going to give you the heart rate. It should give you your temperature and respiratory rate, like how fast you're breathing, how fast your heart is beating, your blood pressure. Now, I want to set off an aside for hypertensive males because we're doing a male exam, not just hypertensive males. But if you have hypertension or which is high blood pressure, and you're on medication, and especially don't be overweight and don't add prediabetes or diabetes into that. But if you have hypertension and you have never seen a cardiologist and you're 40 and over, I got a problem with your primary care. Don't say, oh, we do an EKG. An EKG tells you exactly what's happening with your heart at one specific time. That's it. But it's like, have you had a stress test? Have you had a treadmill stress test? Have you had an echo? How are the valves in your heart working? Do you have cholesterol around the vessels around your heart? That's why it's like people don't get proper, so when he was going to the doctor, people don't get proper assessments, and then all of a sudden, boom, something catastrophic happens. It's like, we didn't know. Well, a proper assessment wasn't done. So, and I get really agitated with doctors who don't want to refer out. It doesn't mean you're not good at your job. It doesn't mean that the money's not going to ever come back to you. It just means that this person needs to be fully and completely assessed. And I don't care if you have high blood pressure and you're over the age of 40, you should have had a cardiology assessment, point blank, period. If your doctor didn't do it, it's a conversation you need to have, period. Now, also with those vital signs, what they're going to look at is your weight. And we know that an overwhelming majority, probably about 70% of Americans and 85% of African Americans suffer with obesity, which is a disease. It's a whole situation when it comes to obesity and what we're doing about it. Don't get me started on that. That's a whole nother video. But when we're looking at males and we're looking at, and again, this goes for females too, but we're talking about the males today, the abdominal circumference, or how big their belly is a direct correlation to their risk of heart disease, heart attack, and all of the above, okay? So when you think your little zaddy, it's cute and it's sexy or whatever, that he got a big belly, it ain't, sis. It ain't, and it's for his health, not about he doesn't look good, because that's you. That's all you, how he looks, and that's all y'all, but it affects his health. That tummy sitting up there, it increases his risk of heart disease as well as diabetes, okay? So we want to pay attention to those things, and we haven't gotten past anything but the vital signs. And if we are pre-diabetic, for all the doctors who are out there saying, oh, well, there's nothing to do about it, there is something to do about it. There is a medication you can take for pre-diabetes. There is a diet plan that you should be following. There is a workout plan that you should be following. So that annoys you when they're like, oh, well, change what you eat. Well, you've been eating the same thing for 50 years, but you're going to change it because they said change it? Don't make sense, and it's not an easy thing to do. And you come back in 3 months and the results are still the same. So let's not set our patients up for failure. If you're a primary care and you're watching this, when people are pre-diabetic, treat them, especially hypertensive patients. Treat them. I'm just saying. So in any way, if somebody tells you, oh, you're pre-diabetic, and how do you know that? It's a blood test called a hemoglobin A1C. If it is above 5.7 or it's above 5.6, you're pre-diabetic. Point blank, period. And we got to get those numbers down, honey. Down, down, down. All right. So when we deal with the medical history, because the medical history is going to come after the vital signs, this is your time to shine. Okay. This is it. This is your time to shine. This is your time to tell the doctor as a partner, and it's specifically if you are the patient, any time that you've been having any particular issues, concerns, like, every now and again, this little left arm get the tingling on me. Yeah, that's the time to talk about that. Or I don't know, I just be getting this little twitch and my eye won't stop. It be going for days. That's the time to talk about that. How you can get an erection, but maybe you can't keep one, or it's not as firm as it used to be. This is the time to talk about that, because pearl clutcher. Talking to my man, Dr. Dave Montgomery, shout out to Prevent Clinic, where we send all our patients for cardiology care. We don't play. But Dr. Dave says that erectile dysfunction is heart disease until proven otherwise. Now, notice he said until proven otherwise. That means that we're going to prove it. We're going to go in, we're going to get some stress testing, we're going to do some this, that, and the third. We're going to take a look at these varicose veins in the legs. Do we have venous insufficiency? Because y'all think, oh, varicose veins are just for women. No, no, no. The varicose veins in the legs could be venous insufficiency when it comes to male fatigue legs, tired legs, legs showing up that can also contribute to erectile dysfunction. Do we have low testosterone? So it's a bunch of stuff, but the medical history is where you clue your doctor in as to what to test you for outside of the standard stuff, okay? So don't be afraid to be like, no, I'm cool. Don't do that to yourself. Like, speak up, like, something going on. I used to love broccoli. I don't love it now. Y'all gonna go too far. Some the people might shut you down and be like, you got 3 complaints, because some people do that. But this is the time to shine. This is the time for your partner to express their concerns. It's the time for you to express your concerns. And then they're gonna ask you about family history and does this run in your family and that run in your family. If you don't know, maybe making a phone call or two might be the thing to do prior to going for your examination, okay? Now, the physical examination. This is the part that's going to be the pearl clutcher. The physical examination is all the regular stuff that we do, like the heart, the lungs, the lymph nodes, checking for your thyroid, swallowing all so you can checking for the lymph nodes, your reflexes, all of that. But this is where you can actually learn a lot, right? And like I was saying, even the varicose veins, sometimes they might just look like ugly, busted veins or whatever the case may be. And dudes are like, I don't care about that. You know, I'm gonna wear my shorts regardless. Right, but that could be a sign of what we call venous insufficiency, meaning the veins in your legs are not working as well. They're not getting the fluid back up to your heart as well, which is easily fixable. It is not a surgery. It's a procedure, same day, no downtime, easily fixable. And it decreases fatigue in your legs and it decreases the appearance of the varicose veins as well. And then it helps with vascular insufficiency. And if that is a part of the erectile dysfunction, like I said earlier, that'll help with that as well. But the physical exam is where a lot can be learned. You know, people don't realize that you're actually supposed to have a yearly dermatology exam or dermatological exam where actually you kind of get like butt naked and with like a magnifying glass, your doctor's supposed to, and nobody come in my office asking me for this. This is your primary care or dermatologist, okay? That a magnifying glass and look over any suspicious spots or moles or anything that doesn't look right, any rashes, anything, and biopsy them and get some information. So do not discount a good physical examination when it comes to guys. I mean, their toes, you know, whether it's fungus on those feet, fungus under those toes, whether they need a podiatrist, all the things, right? This is a part of taking care of them. Now, and you know, them taking care of themselves. Now, there are 2 things that are elephants in the room, and I really want to get to those because, honey, let me tell you, when I tell you that I was, I don't know, 2 or 3 years old ago, I don't know if I said that right, but whatever, y'all know what I'm talking about. I just learned that, you know, guys are always so scared of the prostate exam, prostate. And it's really interesting because I learned from a friend of mine, like, hey, listen, I ain't with that prostate exam. I have them do a blood test called a PSA. And that's prostate stimulating antigen. I have them do a PSA. And then if the PSA is abnormal, then we can go and do some examination stuff. But you ain't figured to just, you know, be fingering me. And I always thought it was a great compromise. So when my patients would come in, they'd be like, yeah, my husband don't want to go because of A, B, C, D, and E. I would offer them that option. They were like, dang, doc, that's what's up. So again, in talking to my boy, Dr. Montgomery, he was like, yeah, nobody does the digital prostate exam anymore. If your doctor is sticking his finger up there, it might just be because he like it, because nobody's doing that anymore. And I was like, say less. I was like, well, what? You better shut your mouth and keep on talking. And so what he said was, again, like I've been telling people for years, again, I got that from an associate of mine to get the PSA. He said, really, when things start with the prostate, like cancers or masses or anything like that, they generally are going to start in the front of the prostate, right? But when you stick your finger in the booty, that's going to examine the back of the prostate. So if somebody has something going on, 9 times out of 10, the digital exam, unless it's real out of control, the digital exam is not going to tell you a whole lot anyway. That PSA, that blood test, is what's going to tell you what's popping with the prostate. Pearls, well, this ain't pearls, this is Van Cleef, but clutched, okay? Clutched. Just saying. So for all of y'all men who's scared to go to the doctor because they think, you know, they're going to make a punk out of them or whatever the case may be, tell them they don't have to be afraid of that. Now, the only other exam, obviously, they have to do the testicular exam. Testicular exam is a large word for checking the balls. Now, essentially, all they're going to do is they're going to stick their little finger in that little space, a little fossa, whatever it is, tell them turn their head, cough. And that ain't painful. It's just somebody putting a finger near your scrotum, aka your balls. And that's pretty much it. That's all they're really gonna do on their physical exam or with their junk, okay? So tell them don't be scared. Nobody's invading their privacy again. And for a man who be like, no, they stuck their finger inside, either one, you're lying and you didn't go, or two, your doctor's a freak and they out there. I'm just saying. So there we go, boom, bam. And also your STD testing. Now, again, I don't know, some little leprechaun back in the 1980s done took it back and told y'all that, you know, people sticking Q-tips in the tip of the penis, which back in the 80s they did, and I think the early 90s too. But we're past that. We have you pee in a cup now. So you pee in a cup, and the only thing that will always, and y'all know my spiel, the only thing that will always come back as negative, honey, is that trick. The trick is always going to come back negative, period, point to the blank. If you got, I tell people all the time, like, if you got it, I don't care where it came from, and it's sexually transmitted, then he got it. It ain't no way y'all had raw sex and he ain't got it, but you got it. And I don't care who gave what to whom. The point is that if it's sexually transmitted, both people got it. So his testing is going to come back negative. This is just an aside. So if you got tricked, Miss Ma'am, tell him to just go to his doctor and say, my partner has tricked and I need to be treated. But my partner got tricked and I want to get tested. He's always going to come back negative, and then he's not going to want to take the treatment, and then the doctor not going to want to give him the treatment because, again, likely it's a primary care who doesn't realize that men are going to come back positive for trick. I mean, negative for trick. And so he's not going to want to treat him for something. He or she is not going to want to treat him for something that they're negative for when technically they're not really negative. Don't get me started on that one either. We'll do another video. So we have gotten through the examination of all the male parts with blood testing, and we're going to do blood testing for a bunch of different stuff. They should be screened for cholesterol, diabetes. Again, we talked about diabetes being the A1C and checking their glucose, the cholesterols, all the lipid panels. We check for the good cholesterol, the bad cholesterol, all of it, okay? Colon cancer screening. Now, I want to talk about colon cancer screening because a lot of, again, the primaries are giving these little cards, having you wipe poop on the cards and then mail them in. I don't think that's terrible. I don't think it's colon cancer screening. Okay, what does that mean? So the little cards, I mean, if it's the only choice that you have, then I think it's great. Let me break down the differences. So with the card, it is about, I don't know, 90% effective at checking colon cancer, right? And it is about 45% effective at checking for polyps or precancerous polyps, which is what we're looking for. That's why it's a colon cancer screen, okay? Now, when you have the colonoscopy, which is when you go, they give you some sedation. You don't really know what's going on. They stick the camera in your booty. You can't feel nothing. If there are precancerous polyps, they snip them off before they become cancer, and you're told to come back within either 3 years or 5 years before you have another colon cancer screening. So essentially what I'm saying is, and that's about 99% effective. So essentially what I'm saying is the card is all you can do. Then do the card, but the card doesn't pick up anything significantly precancerous. It picks up more cancer versus precancer, whereas that's the whole purpose of the screening, to get in front of the cancer and get the precancerous polyps out. Does that make sense? I hope that makes sense. So again, if that's all you have, if you may not have any insurance this go around, I guess I'll get it next year, but I don't have any insurance this year. You can't pay for a colonoscopy, and you're not having any symptoms, and you don't have a family history, and the card is all you got. The card is better than nothing. But please don't think it's an even exchange, because it's not. Lung cancer screening. Again, that's going to be patient specific, but it should be done if you are, I believe any patient that's over the age of 60 should have a chest x-ray, point blank, period. But if you're a smoker, if you've been a smoker, if you live with the smoker, if you have any respiratory illnesses, any asthmas, anything like that, certainly, or any symptoms, obviously, certainly a chest x-ray or whatever your doctor deems to be the appropriate test for lung cancer screening. Now, this is a big one. The next one, y'all. The mental health screening. No. Males exhibit things differently than we do. And a lot of times, mental health in the male population is now being more accepted. But it was accepted as in when you deal with depression and anxiety, and bipolar disorder and things like that, they were looked at as forms of weakness for men. Like, I ain't got that. I'm good. I'm good. And I think now we are more apt and prone to deal with dudes like, man, it's just, I'm feeling rough. It's rough out here. You know, fatigue is even a sign of depression, overeating, undereating. You have so many different things that are subtle signs of depression. And if the doctor doesn't ask, I think you all should be saying, hey, listen, you ain't asked me whether I'm tired, 18 hours out of a 24-hour day. You didn't ask me whether I was feeling down and just couldn't get up, despite the fact that everything in my life is great. You didn't ask me that. You didn't ask me any of those things. So guys, start advocating for that stuff and make sure that it is becoming a part of your screening, because sometimes we are going through depressive stages and we are going through depression and we don't even know. Like, and I say we, I mean people in general. So please make sure that these questions are getting asked of your partner or of you yourself. Now, the last thing, which is very, very interesting, is vaccinations. And you figure at this big age, who is getting vaccinated? Well, honey, here's this. Your grandkids. They're magnets for foolishness. I'm sorry, I hate to say it. They just so sweet, bless their hearts. I love them, sugar, but at the end of the day, they carry so many damn bugs. RSV, y'all got to be careful. RSV will take you up out of here, okay? And the kids ain't got nothing but a runny nose, and it'll take you up out of here, especially if you're asthmatic, especially if you have any respiratory things. And I tell my patients, if you're gonna be around them grandkids and you are over the age of 60, you better get that RSV vaccine. People say, I don't know what's in that vaccine. You don't know what's in the damn Ozempic that's coming from the compounding pharmacy either, do you? You don't know what's in the semaglutide, the tirzepatide, or anything that's coming from the compounding pharmacy. You don't know what's in that, but you're shooting yourself up like you ain't got no sense every week, right? Don't get me started on that either. So at the end of the day, if you have any questions about, certain things, people feel differently. Some people get the flu shot every year. Cool. Some people get the pneumonia vaccine every year. Cool. But one that you haven't potentially heard of is if you have grandkids, if you're going to be around your grandkids, RSV is a very important one to talk to your doctors about, because like I said, it is relentless. It ain't playing no games. Also, they have the little shingles vaccine, but I ain't got no shingles until you get shingles. And it is nothing to be played with. That pain is pain, baby. So those are the things. So ladies, I hope you learned something. Guys, I hope you learned something. I hope you feel empowered, more empowered to go into the doctor's office, because as I say all the time, essentially, if you give us some blood and you give us some urine, we can learn everything we need to learn about you. Ain't nobody got to go sticking their fingers up yonder, and putting tow trucks in and pulling stuff out. We not doing that. We do not have to do that anymore. Medicine has evolved. So just like we need you guys to understand what women have to go through on their exams and what y'all are looking for and how to protect yourselves, yes, we protecting the girlies too, and we telling them what they need to look for and all the things, and just to protect you as well. These things are not shouldn't be looked at as bothersome, but these things can really prolong your life and decrease so many potential issues and problems and concerns, if they can just be addressed before they become a concern. So again, I hope this blessed somebody. I hope there are some primary cares looking at this and decide to adjust the way that you do things, for the betterment of patients. And for those who are already doing it, I applaud you, shout out to you, and thank you so much for joining. And we'll see you back on Podcast Thursday.